Okay, the next study is National Trends in Pediatric Firearm and Automobile Fatalities. Will be presented by Jenny Stevens from Children's Hospital, Colorado.
Good morning, everyone. Thank you for the opportunity to present our work. We have nothing to disclose. Since 1999, the leading cause of death among children and adolescents in the United States has been automobile accident-related injuries. During the same time period, firearm injuries have represented the second leading cause of death in pediatric cohorts in the U.S., the country with the highest pediatric firearm injury case fatality rate of all industrialized nations in the world. A recent review of the state of Colorado's injury fatality data found that for the first time in 2019, firearm injuries exceeded automobile crashes to become the leading cause of child and adolescent death in our state. Thus, the aims of this study were to evaluate national trends in pediatric firearm and automobile fatalities from 1999 to 2020, to evaluate trends in firearm fatalities based on firearm injury intent, and to determine the impact of individual state gun law strength on pediatric firearm injury fatality rates. We hypothesized that firearm injuries would surpass automobile injuries to become the leading cause of child and adolescent death in the U.S., and that state gun law strength will significantly impact pediatric firearm injury fatality rates. Annual pediatric fatality rates for both firearm and automobile injuries were collected from the CDC's wide-ranging online data for epidemiologic research, or WONDER database. CDC WONDER manages nearly 20 collections of public use U.S. data, and deaths are obtained from death certificates from 57 vital jurisdictions. To determine state gun law strength, we utilized the Giffords Law Center annual gun law scorecard, which categorizes gun law strength by letter grades, from A, which is the strongest, to F, which is the weakest gun laws. Poisson generalized linear mixed models with a log length were used to model fatality rates, and this allows for regressions to have a random intercept and slope for each state. For aims 1 and 2, time was treated continuously with 1999 indicating year 1. Firearm and automobile deaths were entered into the same model to test for differences in rates by injury type. Quadratic trends as well as interaction between time and injury type were tested. Firearm deaths were then stratified by injury intent and entered into a separate model to estimate and test for differences in rates. For aim 3, time was treated continuously with 2014 indicating year 1. Quadratic trends, interactions between year and gun law grade, and population were considered as covariates. Rates were then estimated at multiple time points and compared between state gun law grade levels. As you can see in the figure, in 1999, the national pediatric fatality rate for automobile injuries was 248% higher than that of firearm injuries. However, by 2020, the national pediatric fatality rate for automobile injuries had dropped to 16% lower than that of firearm injuries. Here you can see estimates from our model at various time points. In 2019, due to significant decreases in automobile injury-related fatalities, firearm injury-related fatalities surpassed those secondary to automobile crashes, and this trend continues in 2020 at an even greater rate. We found an increase in the estimated fatality rates of all firearm injury intents except unintentional injuries throughout the study period. When evaluating gun law strength, for each increase in letter grade from F to A, there was an 18% reduction in the pediatric firearm fatality rate. States with the strongest gun laws, grade A, had an estimated 55% lower pediatric firearm fatality rate compared to states with the weakest gun laws. As you can see that in 2020, there were increases in firearm fatality rates across all grade levels compared to 2014. The strongest gun laws appear to protect against the greatest increases. In conclusion, from 1999 to 2020, there was a significant decrease in the national pediatric fatalities secondary to automobile injuries, without significant decreases in fatalities secondary to firearm injuries. From 2019 to 2020, firearm injuries surpassed automobile injuries to become the leading cause of death in children and adolescents across the U.S. State gun law strength has a significant impact on pediatric firearm injury fatality rate, as states with the strongest gun laws had the lowest firearm fatality rates, and those with the weakest gun laws had the highest firearm fatality rates. Beginning decades back, efforts to improve automobile safety for children and adolescents have resulted in significant decreases in automobile accident-related injury and death. Pediatric firearm injury and death is an increasing public health crisis in our country, and this will require similar safety-focused approaches, including public health policies to strengthen state firearm legislation, education to improve safe storage practices, and developing research efforts into effective injury prevention strategies to curb this ongoing crisis. I'd like to thank all the contributing authors who worked on this project with me in Children's Hospital, Colorado, and thank you for your attention, and I'll take any questions now.
Congratulations on a very, very powerful study and timely. I think there was an article in the New England Journal just last week with the same conclusions. Open to questions, comments?
Brian Coakley, New York. That was phenomenal, and congratulations on your work. It's very, very important. I'm curious, you looked at the legal environment. Did you look at any measures that might just correlate with the number of guns in circulation? So either rates of gun ownership or measures of ATF registered weapons or ATF federal firearm licensees and how that may correlate. We certainly see linear relationships in terms of adult data with number of gun-related deaths versus number of guns in circulation. And I'm curious if you saw anything among pediatric populations similarly.
Absolutely, that's a great question. So the Giffords Law Center evaluates each piece of legislation in every state, and they assign a point value for each state gun law. And then that's tallied up to get a range, which is then translated into the letter grades. And so some of those laws certainly impact, I think, if you have easier or more lenient laws in a state, it's likely to correlate with higher levels of firearms in that state. We know that child access prevention laws, when they're in your state and when they're stronger, there are lower levels of gun ownership in that state. So we didn't specifically look at the number of gun ownerships in each state to correlate that. It's a great thing that I think we'll do going forward, but I think there is some connection between the overall strength of firearm legislation in your state and gun ownership in the state.
Do you have any plans to take this data into the lay press, or what are your plans for that?
Yeah, I mean, I think this is what I've presented is this is the big picture. This is the 30,000-foot view, and I think it needs attention from policymakers. It needs attention from the general public. It needs we need to all be aware of it, and so then we can take steps to try to mitigate this going forward. So I think that's an excellent opportunity for us to kind of show what we're dealing with in America and to come up with some solutions for it going forward.
Thank you.
Thank you. Max Langham in Memphis, Tennessee. A state I'll note is a D- on your scale. Thank you for bringing this. It's depressing to have spent a career taking care of kids and seeing a major public health crisis emerge in our area. To fix this, we're going to require change in behavior. And I wanted to, just point out that all of the tests in your paper are tests of association, not of causation. And I suspect that in Tennessee, our gun ownership is higher, our attitudes are different, along with the laws being different. And so I think it's going to change. It's going to require more than a change in law. And I was wondering if in the research, which we're fortunately now starting to fund in this public health crisis, if you're aware of anybody actually working on change in behavior. Education hasn't worked very well. Laws haven't worked very well. What we need is a change in personal behavior. And I've not seen or heard any of that. Thank you.
Thank you for your question. It's a great point. I think one behavior that we could focus on is just safe storage practices. And if we just keep our firearms in a safe and they're not loaded, I think that would make a huge impact, especially on unintentional injuries that we see in lots of parts of the country. So I think that's a step going forward, is that we've looked now a lot at the mortality and the morbidity associated with these injuries. I think now we have to see what are the things that are actually improving behaviors and how can we do that. And it's going to take a multidisciplinary area that is probably different in Memphis, Tennessee for you than it is for us in Denver, Colorado, than it is in Boston or New York. I think we need to take this and get some more granular data in our own communities and our own states.
Thank you so much. Great work.
Thank you.